Wastewater surveillance and testing allows us to detect and respond to increases in infectious diseases and target prevention efforts to communities that need it most to help prevent outbreaks. In 2020, with an urgent need for additional surveillance methods in response to the COVID-19 pandemic, public health turned to wastewater surveillance to support and inform the nation's response. As the use and visibility of wastewater surveillance has expanded, there is the potential for increased public health impact and a need for further attention to important issues with ethical dimensions. In May of 2024, ASTO convened partners engaged in wastewater surveillance to explore these issues and inform the development of ASTO's framework for addressing ethical considerations in infectious diseases public health wastewater surveillance. These experts working in the field shared their insights on the importance of wastewater surveillance and why it is so critical to maintain ethics at the center of this work.
Wastewater testing is it's convenient for the public. It's a non-invasive way to go about getting information from people. We don't need to ask the public to come in and get testing at a clinic.
Wastewater monitoring is an important tool for infectious disease monitoring because it really strengthens the existing monitoring systems we have and complements existing information on clinical cases and emergency departments and allows us to better capture the community.
Public health can actually use this tool as a wastewater surveillance to actually take its data and change it into public health action, because at the end of the day, you want some type of policy that is data-driven. Establishing ethical guidelines is also one of the key things as we move forward with wastewater.
There are so many different things that you can test for using wastewater, and there are a range of diseases and their spreads that we don't understand fully in a community, and so wastewater monitoring is really going to enhance our understanding of how diseases spread. So as we complement existing data systems for flu, RSV, it was able to be a useful tool for Mpox. So I'm really excited about the expansion of different targets that we can monitor for an infectious disease. The other thing I'm really excited about in wastewater monitoring is the more data that we have and the longer these robust systems that we've built and continue to build have been around, the better we're going to understand the data and the better we're going to be able to turn it into really useful public health action.
What I'm most excited about when it comes to the future of wastewater surveillance is being able to utilize it to distribute resources or provide resources in a more equitable way. And I think this is most important when we have limited resources. So for example, in the region where I work, we have some extremely high tuberculosis rates, and we don't have the ability to go out and test everyone everywhere to figure out who might have TB or how to allocate those testing resources and treatment. But by using this population level testing, we can figure out where the resources are needed the most and be able to provide those in a targeted way and in an equitable way.
It's important that we conduct wastewater monitoring in a way that aligns with ethical principles, because that's our responsibility as public health organizations to use technology and tools to help everyone and to do that in an ethical way. And what we risk by not having these conversations and incorporating ethics into everything that we do is, not only eroding public trust in organizations who are doing work that is well-intentioned, but we also risk losing the ability to use this really valuable transformational tool that is wastewater monitoring.
We need the public's trust in order to be effective. Public health is not just scientific. It involves culture and involves values, and being ethical shows respect for individuals, and it shows that we're making an effort to improve their well-being.